Respiratory 102, Chapter 20. Pulmonary function tests. Pulmonary function tests are a process of having a patient perform specific inspiratory or expiratory maneuvers that provide information on individual processes that support gas exchange. The purpose being to identify impairment and its severity. Three categories of measuring are dynamic gas flow through the airways, lung volumes and capacities, and the lung's ability to diffuse gas. 5 PFT indications are to identify and quantify changes in pulmonary function, such as with impairments, to evaluate the need and quantify therapeutic effectiveness, like picking what medication to use, to perform epidemiologic surveillance for pulmonary disease, such as abnormalities that may have arose from their environment or work, to assess the risk for postoperative pulmonary complications, and to determine a patient's pulmonary disability severity. 6 PFT contraindications are recent abdominal, thoracic, or eye surgery, hemodynamic instability, pneumothorax, recent history of abdominal, thoracic or cerebral aneurysm, recent hemoptysis, and symptoms of acute severe illness such as chest pain, nausea, vomiting, high fever or dyspnea. 3 post-PFT diagnostic questions to ask are: is lung disease present? What type of impairment do they have, if any? What degree of impairment, how many impairments, if more than one, and can they be separated? 5 follow-up therapeutic questions are: is therapy or medication indicated? What would be most effective? Is the disease reversible? Can the treatment be evaluated? And is rehab feasible? 2 forms of PFTs are spirometry and lung volumes, which are used at bedside, and diffusing capacity, which is done in the lab. The principles of measurement and significance when doing PFTs are test sensitivity and specificity, or its ability to detect diseases; validity, or its ability to measure correctly; and reliability, or its consistency. Some PFT equipment used is the spirometers, which measure volume, and pneumotachometers, which measure flow. The Wright's respirometer is the main pneumotachometer used. Spirometry equipment standards are: they must be able to hold at least 8 liters. They must be able to record for at least 30 seconds. And they use a 3-liter syringe to calibrate. Pneumotachometer equipment standards are: they must be able to record FVC for at least 30 seconds, FVC for 14 seconds, and FEV1 for at least 1 second.